Hello, everyone. We're going to begin our next session, and today we're very privileged to have with us Professor Shauna Downs. Professor Downs is Associate Professor in the Department of Health, Behavior, Society, and Policy at the Rutgers School of Public Health. She has been a Earth Institute postdoctoral fellow at Columbia and also a fellow at Johns Hopkins. She has lived in Canada, in Calgary, so for her, we're in the middle of a heat wave. But of course, she lived in Australia as well with a different climate altogether. Now, Professor Downs has done research in a number of low and middle income countries. Today, she will talk to us about design of interventions in Kenya. And her specific topics of interest include the design, impact, and implementation of interventions aimed at promoting healthy and sustainable food choices. And she has also been looking at measuring food environments in low and middle income countries and how the food environments affect dietary choices, diet quality, and health. Her other research interests, which I'm especially kind of connecting with, are on the intersection of nutrition, climate change, and sustainability. So these are very fascinating topics, and she will apply them today to the design of interventions in low and middle income countries. So please welcome Professor Shauna Downs.
Thank you. Can you hear me okay? Okay, great. Thank you so much for the introduction. I'm really happy to be here and to have the opportunity to talk to you all. It's nice to be in a classroom. I do a lot of teaching on Zoom now, and it's not quite the same, so it's nice to see people's faces. So I'm going to talk about food systems interventions to improve diets and nutrition in low-middle income countries. So I'll start, I'll basically be in this area just because I need to keep the slides moving, but I have a tendency to move around, so hopefully it won't be too distracting. But I'm going to talk about food systems, just get us all on the same page in terms of what I'm talking about. I'll define food environments because when I'm talking about designing interventions, it's really going to be through the lens of thinking first about the food environment. And then I'll talk about two projects, one that I just kind of wrapped up, which was called A River in Transition. So that is in Cambodia. And then I'll talk about a project that's just about to get started in Kenya called Jishifiti Ishifiti. So how many of you have seen this figure of the food system? Okay. I wasn't sure if this would be too repetitive, so this is good to know. So this is a conceptual framework of the food system. It started from the high-level panel of experts report on nutrition and food systems that came out in 2017. My postdoc mentor, Jess Fonzo, was the one that was chairing that group of people working on it. And this is just an adapted version. But basically what you have the drivers of the food system on the top here. So things like climate change, globalization and trade, culture. And then those drivers influence the food supply chain, which is the way food is produced, how it moves through processing, storage, distribution, as well as the food environment. And the food environment is really the space within the food system where consumers interact to make decisions about which foods to acquire, purchase, and consume. And how you make those choices are really based on individual factors. So these are things like income, your knowledge, your health status, where you live, how mobile you are. So you kind of take this baggage or these factors, and that influences how you interact with the food system through the food environment. And my work is really focused on that area. But because the drivers of the food system feed into that, my work also covers those aspects, like climate change as an example, because clearly that's impacting what foods are available, affordable, and acceptable within our food systems. And the reason I'm interested in the interaction between individual factors and the food environment is because obviously that influences diets and then nutrition outcomes, as well as economic outcomes, social outcomes, and environmental outcomes. So as I mentioned, I really focus on the food environment. And part of the reason this is really, I think, critical in terms of designing interventions in low-middle income countries is because food environments are really transitioning. So this is a figure that's looking at different types of food environments, which might be less familiar to you all. So when we think about food environments in high-income countries like the US, we often think about the built environment and the formal built environment. So you might think about supermarkets or convenience stores, restaurants, that type of thing. But when we're talking about low and middle income countries, it's important to consider not only the built environment and the formal built environment, also the informal built environment, which includes wet markets as an example, mobile vendors, street vendors, kiosks and boutiques that you often see in villages in, say, rural areas in Africa and Asia, but also the natural environment. And that includes cultivated, so the foods that people are growing to consume within their households, but also wild foods, so foods that they're getting from, say, jungles, the forests, lakes, rivers, that type of thing. And when we think about how food environments are changing, what we're seeing is there's this shift that's happening as countries move through the stages of economic development. So this is based on Barry Popkin's nutrition transition patterns. How many of you are familiar with the nutrition transition? Okay, some of you. So basically the nutrition transition is this the pattern that you're seeing where low and middle income countries start to have the integration of different foods within their food environments through things like globalization and trade, and that's shifting their diets. And this is looking at how our food environments are changing through the nutrition transition. So you kind of started with hunter-gatherers that were really accessing food only from the wild food environment. But then with subsistence farming, they're accessing food from the wild and cultivated environment. And then over time, the built environment. And then when you get to countries like the US, that's pattern 5. Mostly people are getting their food from the formal built environment. So there's this transition that's happening, and that can inform how you intervene within the food system. Because if you are just, say I work a lot in Senegal. So say you're in rural Senegal, you're not going to come up with an intervention that's just in supermarkets, because that's not the main access point for food for those communities. So the reason why it's important to have this kind of background around the food system and the food environment is because obviously the food system is not delivering for nutrition and for health outcomes. So poor quality diets are one of the top contributors to the global burden of disease. What we eat is making us sick on the whole. So these are just some of the figures related to the global burdens of malnutrition. So both undernutrition, things like stunting and wasting, but also overweight and obesity and diet-related non-communicable diseases. So you see, for example, 148 million children under 5 are stunted. About 2 billion people are deficient in micronutrients. 2.5 billion people globally are overweight or obese. And 2.8 billion people cannot afford a healthy diet. So that's a third of the global population cannot afford a healthy diet. And when we think about the Sustainable Development Goals, diet quality is kind of at the center of many of those goals, not just SDG 2, which is related to zero hunger, right? Because if you are not having a good diet, for example, that's going to influence your education, just as one example. So it's really important to address poor quality diets. And when we think about the SDGs, 2030 is coming up. It's coming in hot, right? It's pretty soon. And so globally, we are off track to meet all of the nutrition goals. So it's really important that there is more attention to trying to make shifts within the food system to make it easier for people to eat well. So my work is all focused on this kind of overarching research question, which is how can we make it easier for the most marginalized populations to eat well in the context of their lived experiences. So how I do this, I start by trying to identify the problem, and I use many different methods to do this. So I use mixed methods, so I do a lot of qualitative research, but also quantitative research. I work with people from many different disciplines. So for example, climate scientists, ag economists, anthropologists, many different groups of people. Then I tried to understand the systems that influence those problems. So what are kind of the root causes of these problems in terms of what people are eating and how that's impacting their health. And then lastly, to design interventions that aim to address those root problems. And here I have co-create solutions, but I heard a quote recently that said there's no, I can't remember who the quote is from, so I apologize for not attributing appropriately. But the quote was, there are no solutions, there's only trade-offs. And that is very true when we think about the food system and interventions to try and intervene within it. So we're constantly making trade-offs. There's not going to be, a magic bullet solution that is all good. There's always going to be some give and some trade-off. So one of the ways that I approach this kind of work is by thinking about these different research questions along the food system. And so this is one of your readings that was included for today's class. So I hope you had a chance to read it. I'm going to go into it in more detail when I talk about the second project, because we're actually using this framework to guide our entire project. So our research questions are derived directly from this approach. But really the idea is to try and identify what the nutrition problems are, what are the diet problems, so like what are the foods that are too available, affordable, aspirational for, in this case, kids, but it could be adults as well. And then what are the incentives and disincentives within the food system, so in the food supply chain, but also in the food environment that are making it easier for people to eat those foods, or making it hard if it's the healthy foods that they're not eating enough of. And then what can you do to address that? So what is the package of interventions that you can come up with to address that? Because like I said, in terms of there's only trade-offs and there's no real solutions, magic bullet solutions. In terms of interventions, you also often need a package of interventions. It's not going to be, if you just have, say, a nutrition education or behavior change communication intervention, that's not going to be enough, right? If you're working with the population in, say, rural Senegal of subsistence farmers that are food insecure, if you're just telling them like to eat more fruits and vegetables, that's not going to be helpful, right, if you don't have access to those foods. So you really need packages of interventions. All right, so the first project I'm going to talk about is the River in Transition project. It's examining local food environments in the lower Mekong River communities of Cambodia. So this is just a picture, if you can kind of see it on the side there, of a vendor that is selling food from her boat in one of the floating villages in the communities that we're working in. This is the study team. So this is a project that's led by myself, my colleague Sweta Manohar, who's at IFPRI now, who was at Johns Hopkins, and Jess Fonzo. And we have co-investigators in Cambodia at the Royal University of Phnom Penh. And then this picture on the bottom is our enumeration team. So the people that are collecting data with us. And this project we did across 2 seasons in Cambodia, so in the wet and the dry season. And in the wet season, that picture is clearly from the wet season. The data collection was pretty adventurous, I will say. We had to do a lot of, wear life jackets at some points, go through like water that's up to here on the back of a motorbike to collect the data. So they are just a great team of researchers that were really instrumental in collecting all the data I'll talk about today. So in terms of the aims of this project, the first aim was to characterize the factors that influence food choice in river communities. The second was to understand river communities' perceptions of environmental sustainability as it relates to their diets and their reliance. Are you guys getting feedback? No? Okay, it's just me. I'm hearing like a little bit of feedback, and I didn't want it to be annoying to you all. The second aim is to understand river communities' perceptions of environmental sustainability as it relates to their diets and their reliance on the river and lake for their food security. And the third was to characterize the health and environmental sustainability dimensions of food environments and their influence on food choices. So we had study sites in 4 provinces and 2 communes or kind of communities within each of the provinces. And they were either close to the Mekong River or the Tonle Sap tributary. So the Tonle Sap is like this huge, it's a floodplain essentially. So it becomes this massive lake during the rainy season. Like it looks like the ocean. It's huge. And these communities really rely on the river and the lake for part of their food access. So we looked at communities that were very near to the lake and the river, and then those that were a bit further away from them. In terms of the methods that we used for this project, we started with something called participatory mapping. And this is it's qualitative, so you do a focus group with community members, and you ask them about their food environment. So they actually map their own food environment and tell you all of the different places where they access food and why they access food from those places, how they get there, how long it takes, what foods they get from those places, that type of thing. And the figure on the right here, this is a digitized version of the map that in one of the communities they created as part of this participatory mapping. The reason why the participatory mapping is helpful is because the way people interact with their food environment is very different from one context to the other. So through this participatory mapping, it really informed our approach to our project. So as an example, in some communities, they really relied on open air markets, so kind of wet markets. So you go and have all the vendors that are selling different foods in a specific place. And then other communities really relied on mobile vendors. So if you were to just do, say, food environment mapping of the different food outlets that are permanent in those communities, you would miss out on the mobile vendors that are the main providers of fruits, vegetables, and animal source foods among those communities. So if you're not talking to people first before you're designing your study, then you might miss out on some pretty important information that will help you to better design interventions. There's also really huge seasonal differences in these communities that were really important to gather from the participatory mapping. So after we did that, we did a series of food environment assessments. So we basically did, in all of the communes, a census of the food outlets in the community. So census meaning we went to every single food outlet along the main commune road, and enumerators would do it, kind of had a checklist. They take the GPS coordinates, and then they'd mark off the different foods that were being sold, and then collect food price data. They also collected data about the promotions, the food and beverage promotions at each of those vendors, as well as along the commune roads, like through billboards, which I'll talk a little bit about. They also did, on a subsample of vendors, they did checklists related to vendor hygiene and safety, as well as sustainability properties, because we are interested in sustainability. So we were interested in what kind of sustainability labelings people had, how much plastic they're using, that type of thing. I won't report on that. There was basically no labels related to sustainability, but there was a ton of plastic. So you often in Cambodia, if you get a drink, for example, it'll be in a plastic cup, and then it also has a plastic bag around it, which is very handy because you can just carry your cup, but it's just a lot of plastic. And then lastly, we did semi-structured interviews with women. So we did interviews with 10 women from each of the communes to understand about what influences their food choices, as well as how they're thinking about the environment, how climate change is impacting them, or climate variability. And I just wanted to say, if any of you ever do food environment research in low middle income countries, please reach out to me. I just had a project finished that developed a whole suite of tools to measure food environments in low middle income countries, and all of the tools are publicly available and are, I think, pretty useful. So I'm just plugging my own project, which I normally wouldn't do, but I do think that the tools are helpful and mean that you don't have to do the work yourself. All right, so I'm going to just share some preliminary findings from this project. The first is how people interacted with their environment. So I'll talk first about the built environment and then the natural environment, which, as you remember, is the wild and cultivated environments. So in terms of where people are accessing food in the built environment, it was mostly small groceries, street vendors, and mobile vendors. And the figure in the middle there, this is GPS mapping of the vendor types in one of the communes. And so the black dots are street food or mobile vendors, the green are small grocery stores, and the red are large grocery stores. So you can see it's mostly street vendors, small grocery stores, and then there's a few larger ones as well. In this community, mobile vendors were also really important. So they were contributing a lot of food to the community. The other aspect that was specific to this community that I've included the map for is they actually crossed the border to Thailand to access their food. And so to go to one of the main markets. And so if we hadn't done the social or the participatory mapping initially, we wouldn't have known that. But it's pretty important because that is where the food that is cheaper is accessed from that community. But obviously, as researchers, if we have to get ethics approval to do our work, and so we can't just cross the border and start collecting data in Vietnam. Like, that's not feasible. So we had to then just understand that we have limitations in the data because of that. There was also big changes across the seasons. So the picture that is on the lower right-hand corner, this is a floating vendor. So in the dry season, this vendor is just, on the road. So as an enumerator, like as you're collecting data or as a consumer, as you're going to get food, you can just walk there. But then in the rainy season, it becomes floating. So then you have to access it by boat. And so that whole community called Kampong Pluk, they have to access a lot of their food by boat during the rainy season. There's another of the communes that we worked in that became an island in the rainy season. So even just to access it as data collectors, we had to take multiple ferries. That's where we rode on the back of motorcycles. And it was like very treacherous. Whereas in the dry season, we just drove there. And it was fairly easy to access. So in that community, it becomes very hard to access food in the rainy season because they're kind of cut off. Mobile vendors will still come, but not very many because they have to pay for the ferry, and the ferry is really expensive. And then in terms of how people are interacting with the natural environment, they are really have a strong preference to access food that they collect from the wild. So because there's these water bodies, they collect a lot of like clams, crabs, snails, that type of thing, as well as wild vegetables. And so they like those foods, and they rely on them also as a safety net in terms of nutrition security, which I'll talk a little bit about on the next slide. So this is just from the qualitative interviews that I mentioned. So we did the 80 interviews with women, and I've just been analyzing those data and trying to bring them all together to understand some of the connections between climate variability and climate change and women's experience in these communities. And basically, they all talked about the impacts of climate variability on them in several different ways. So they talked about increased temperature, increased deforestation, increased variability in terms of rainfall, the severity of storms, which were making them sometimes feel unsafe in their own homes, and more floods, in some cases not enough flooding when they used to rely on the floods for some food production. So there's, in essence, just so many changes that are happening that are impacting their ability to grow and collect food. So then they have reduced food and water access from the natural food environment. So they're not able to collect as many foods. In some cases, women talked about in previous years being able to have an abundance of food from the river or the lake, and then now not being able to access any foods for a variety of reasons. But they also talked about crop failure, so their crops are dying because of the temperature. Animals are dying as well because of heat, among other things, increased infections as well. And so all of that then impacts them in terms of needing to shift away from relying on the natural food environment to having to buy their food. And this is problematic for a few reasons. I mean, all of us are going to buy food. Like, subsistence farmers are still net food buyers. No one is just relying on cultivated and wild foods anymore. But the problem is, when you have very little income, the natural environment becomes a safety net for you. So if you don't have any money, you can still access from the natural food environment. And since that's shifting because of climate variability and climate change, that's making it really hard for people to get enough food and good quality food. The other thing is that they don't trust the food that they purchase in the built food environment. So they think that it is high in chemicals. They're very concerned with the impact of these foods, high in chemicals, on their health. And so they don't prefer it. They demand the natural food that they trust. And so then that creates challenges too, because they're making this trade-off because they have to consume that food because they can't rely on the natural food environment anymore, but they don't want that food because they don't trust it. The other thing is that many women brought up the fact that not being able to rely on the natural environment meant that they had to make a decision between being able to buy food and or pay for the school fees. So they have to pay for their kids to go to school, and that safety net of food from the natural environment is no longer there. So it means that they don't have enough money to send their kids to school. So major changes. So that's why it's important to think about the system more broadly, because it impacts people in various different ways, including, for example, shifting to do more factory work rather than cultivating their own food, which are long hours and for very little pay. Okay, so now I'm going to shift to talking about the built environment. I'm going to run through these relatively quickly, just so that we have enough time for questions at the end. So I'm going to talk about food availability, affordability, and promotions. So this is looking at all of the vendors that were included. So there are 500 vendors included in our sample and different food groups that they were selling. So you can see overall fruits and vegetables were sold by fewer vendors. So were fast food. So fast food wasn't sold very often. But you can see some of the other foods that were sold by many vendors for things like alcohol, fried and salty snacks, sweetened beverages and energy drinks, as well as animal source foods, which is a good thing, right? But there is definitely, you'll see in terms of the promotion, it's also aligned with what foods are available. So lots of promotion for alcohol, energy drinks, and sweetened drinks. So these are just two examples of the spatial analysis from two different communes. Siembuk, the one on the right, that is the community that becomes an island in the rainy season. And basically the red dots, so these are the promotions at the vendors themselves. So when you're going to collect data, you're making note of all of the promotions. So in some cases, they have many different promotions at that vendor. So each circle is one vendor. So if you see multiple colors, it's because they had all those different promotions. But red is energy drinks, pink is sugar-sweetened beverages, black is alcohol, and the fluorescent green is other discretionary foods, and then the dark green is healthy foods, although I don't see any dark green. There was no promotions for healthy foods, but there was a lot for energy drinks, sugar-sweetened drinks, and alcohol. And this is just looking at one market, so we also collected data in the different key markets that people were accessing. And you can see here that there was, in one market, a lot of alcohol advertising and a lot of MSG advertising. So when you go in the market, almost every vendor has an umbrella that's a beer, like one of the beer companies, as an example. And in addition to that, when you look at the billboards in the communities, these orange ones, this is a beer company. And so this is just like in one spot, you're looking at the road, and there's like billboards everywhere for beer. And they're just putting them on people's land. They're not paying for this, the companies. In terms of affordability, we looked at the cost of a healthy diet. So this uses the Healthy Diet Basket, which is basically taking together all of the different food-based dietary guidelines around the world and trying to come up with a general kind of healthy diet basket, and then you calculate the cost of that. So we found the cost to be about 50% of the poverty line in Cambodia, so expensive for people to be able to afford. And it was also more expensive during the rainy season. And when you look at what's driving it, the cost, the blue is the dry season, the orange is the rainy season, and then the gray is the calories, or the kilocalorie contribution. And you can see that in terms of the costs, the starchy staples and animal source foods are contributing a lot to the costs. And when we look at the calorie contributions, though, obviously animal source foods aren't contributing as much. But they're also very nutrient rich, so it's really important to be consuming them. And there are pretty big changes across the season. So on the right-hand side, you'll see the different percent changes across the different communes. I won't go into detail on it, but in some cases, almost 30% increase during the rainy season. And then this slide is just looking at the affordability of all the food groups, not just the healthy diet, because the cost of a healthy diet doesn't include any discretionary, quote-unquote, discretionary foods or any of the foods that aren't part of dietary guidelines. And so this is using the relative caloric price, which is basically just looking at, relative to a starchy staple, how expensive are these different food groups. So it's using the starchy staple as the basis. And you can see that a lot of the kind of energy-dense foods like potato chips, fats, oils are cheap, right? So they're pretty similar, a little bit higher than the starchy staples, but not too much. Some of the nutrient-rich foods, though, are much more expensive, like dark leafy greens, milk. But, you know, fruits and nuts and pulses are actually pretty affordable, actually. And then in terms of quality, there were some definite challenges in terms of the quality. So this is a picture from a mobile vendor. So they're driving on their mobile vendor, like on their cart, the whole day. So we went to the market, the main market where the mobile vendors are getting their food from, at 2 a.m. because that's where that's when they're getting all the food. And then they're driving around to the different communes for hours in like 40 degrees Celsius heat. I have lived in the US for 10 years. I still don't know Fahrenheit. So that is, I think it's like 100 or something. It is very hot. And there's nothing covering this. This is meat. This is a butcher mobile vendor. So you have the dust, the temperature, exposure to different pathogens. So there's some serious quality concerns here and safety concerns. And when we did checklists with the subsample of vendors, we also found that a lot of the vendors were selling the food on the ground. So you have similar issues in terms of hygiene and safety. Many of them were damaged. Much of the food was damaged, squashed, or spoiled. 50% had flies or insects on it. And this is tricky. The reason I highlighted this is because I mentioned there's that concern around pesticides. And so for some, in the qualitative interviews we did, and this is why it's important to do both quantitative and qualitative work, I think, but in the qualitative interviews we did, women talked to us about how if they saw insects on the food, they sometimes saw that as a positive because it meant that they weren't using as many pesticides. So whereas from the perspective in the US, we often think if we see flies on food, we're probably not going to purchase it, right? But in that case, they sometimes thought that was a good thing. But it really was variable, so not all women felt that way. And if it's a caterpillar, they feel more comfortable than if it's flies. So the insect matters too. And then in terms of vendor water, so many of the vendors, about 40%, didn't have water at their stall, meaning that they can't wash their hands, which obviously increases food safety issues. And then those that did have water, it generally wasn't very clean. So how can this type of information help us to design interventions? It can highlight where in the food system you should intervene to improve diet quality and nutrition outcomes. So in this case, mobile vendors, because they were such an important part of the community, And I didn't talk much about the mobile vendor data, but we basically had a data collector that stood or sat in one spot all day long at a thoroughfare in the communes to collect data on every single mobile vendor that entered the commune. And so that's why, because they were so prominent in many of the communities, that's why it was an important entry point for interventions, particularly around food safety and hygiene, because you saw that meat that's just kind of out there in the open. Regulations related to food and beverage promotions, and actually since we did this study, Cambodia has now banned alcohol advertisements along the roadsides, so that's a really important policy impact, right? Or leverage points. So even in terms of energy drinks, that could also be an important entry point for regulation. Also labeling or certifications, because people care so much about the source of their food and the quality of food. If there's some kind of labeling system, that could help to increase trust. And then also preserving the natural environment, so through conservation efforts, to make sure that people still have access to that wild and cultivated environment. Okay, so quickly, I'm going to shift gears and talk about a project that's just getting underway that's funded by the NIH. It is called the Shifiti Ishifiti, which is Eat Well, Live Well in Swahili slang. So this project is a participatory project with adolescents in Kenya, and they came up with the name. So they've been involved from the start. This is a team. I am co-leading this project with my great colleague, Gwen Lee, and then we have a bunch of different people working on the project from in the US, in the UK, and in Kenya as well. So we have biostatisticians that do systems modeling, ag economists, MDs, nutrition anthropologists, many different backgrounds. So in terms of what we're doing, we're working across a gradient of formality in Nairobi, Kenya. So we're working in 2 informal settlements or slums, and then 2 kind of semi-formal locations. So they're a bit more formal than informal settlement. So they're kind of like tenements, if you're familiar with that, and then 1 estate. And we are working with 700 adolescents across these communities, and the data is kind of being organized around their schools. So we're collecting them and recruiting students within schools in each of these communities. And so we are using that paper that you had as part of your readings as the guide to this project. So we're using various different methods to come up to answer all of these research questions. So 1, what is the burden of multiple forms of malnutrition in this population? So we are measuring heights and weights, waist circumference. We're doing blood draws so we can measure micronutrient status at 3 time points within a year, within a school year. In terms of diets, which foods should adolescents' food systems make more available, affordable, acceptable, and appealing? So we're doing a lot of data collection around diets, so 24-hour diet recalls, also a lot of qualitative work, something called concept mapping or cognitive mapping with adolescents. We're also looking at what adolescents are eating or not eating and how these foods relate to the food environment. So we're mapping the food environment using this suite of tools that have been developed as part of the food environment toolbox to do that. We're measuring food insecurity, water insecurity, to understand the household factors that are influencing adolescents' diets and nutrition. We're also doing a lot of group-based modeling. So we're interacting with adolescents as well as their caregivers, teachers, principals, and then also other food systems actors to come up with interventions. So getting them to basically create systems, diagrams of their environments, and then identify the levers for where we could have an intervention. And then all together, throughout the whole project, we're involving stakeholders to design or co-create these interventions that are focused on improving adolescent diets and nutrition, using the data that we're collecting as part of this project. So it's rooted in empirical data. So I won't go into all the details just because, like I said, I want to leave room for questions, but we're really focusing on adolescents at the center and trying to take their experience to try and improve their food system through a package of interventions that have buy-in from stakeholders within the communities. And we have great community partners that are helping spearhead this work. So, in terms of concluding thoughts, centering people's lived experiences can really help to identify food systems interventions that address the root causes of poor quality diets and malnutrition. In low middle income countries, I think it's really important to think about the diverse access points for food, because the interventions will be very different based on those. And working with populations to co-create interventions, so bringing them along through participatory practices or research, I think is really critical to make sure that the interventions are actually addressing their needs. Because, you know, development has a problem with just thinking like top down, we know what these people need, and that is not true. People know what they need. And so involving them from the beginning in a meaningful way is really critical to design nutrition interventions that are really going to have an impact. So with that, I thank you for your time, and I'm happy to answer any questions you might have.
Thank you so much. I have a question here that has to do with the intersection of policy, politics, and nutrition, which is exactly where you're at. For example, with the Mekong River, you have climate change, but you also have 3 dams on the upper Mekong, which are going to be influencing Laos, Cambodia, and Vietnam, all of which are downriver. You correctly say Tonle Sap is the critical place. So where do you look at this intersection of policy, politics, and nutrition? It's very interesting.
Yeah, that's such a good point. And I didn't talk about it, but it's not just climate change there. It definitely is man-made. So the deforestation also is part of it. But yeah, the damming in the Mekong is really impacting people. And they talk about it in the interviews too, because it's changing the flow of the river. And that's why they don't have access. That's one of the main reasons they don't have access, particularly in the river. So we, as part of that project, we had initially planned to do political economy analysis as well, which is essentially do interviews with stakeholders, including the Mekong River Commission, to try and understand what is the current policy context, how we can sort of work with that. But it's really tricky because there's so many countries, and China's really the country that rules the show. Yeah.
Project. In fact, we'll be talking about it next week, so thank you for bringing it up. The issue of prices and affordability. And also one of your slides was something very critical, looking at the cost of the various foods relative to the staple cheap grain.
Yeah.
That's a novel approach. I like that a lot.
See, thank you. I don't know, there's not a perfect way to compare, right? And so for the food prices for nutrition, the cost of a healthy diet, they're very adamant that only, obviously, healthy foods are included in that. And whenever I've had conversations with them about how to best compare different food groups, no one really knows what the best approach is. And so the starchy staple, that's from Derek Keaty, who's at IFPRI. He's the one that that was based on. Yeah. Mm-hmm.
Any questions from any of you? Please ask. Yes, go ahead.
So your work is identifying interventions that will be helpful. What organizations then take that information and implement it? Like, where does it go from?
Yeah. That's a great question. And sometimes I also do intervention work. So sometimes it's like if we have funding, we will actually implement the intervention and then look at the impact of the intervention. So I didn't talk about it, but I work with some amazing people in India at the Georgia Institute, and we're implementing a food systems intervention that came from the community. But in other cases, it really depends on the context. So a lot of times there are NGOs that are already in place that will be able to implement it. Sometimes it's the government. It really depends what kind of intervention it is, if it's policy versus more of a community type intervention. But that's why it's really important also to integrate stakeholders throughout the process so there's buy-in to take up those interventions. Because if you're just like, you do your research project completely separate to them, and then at the end, and same with policymakers, like before we started the project in Cambodia, we met with policymakers to make sure they had buy-in and that the project was aligned with their nutrition strategy so that at the end, they're willing to take up the information. Otherwise, it's just like, well, why do you know better than us, you know? Which, fair enough. Yeah, so most of the vendors that I talked about are informal vendors, so they don't pay any licensing. And that's one of the challenges, because a lot of times there's this emphasis on trying to formalize the food sector, but then people have to pay for it. This happens a lot with markets. So a government might decide to have a government market. Like in Cambodia, this happened. So they created the infrastructure, but then they charge vendors to sell at that market. So then what happens often, the vendors just sell right outside of the market. So the infrastructure that was built is empty, no one's there, and then just outside of the market, people are selling their foods. So but when there are also vendors that are part of the formalized system in different countries, and then they do pay for some sort of licensing. Mm-hmm. Yeah, so that's a great question. So there's a lot of, I didn't talk about this at all, but there's a lot going on in the fisheries sector. So there's some conservation efforts. Were you talking about preservation or conservation? Yeah, okay. So there's a lot of conservation efforts, and in the qualitative interviews, women would talk about it because it created some challenges because some people were still illegal fishing. They would use like equipment that's not allowed, which allows them to catch more fish, but then the resource was depleting. And so there's kind of this trade-off between I need to eat now, like I need to fish so I can eat, or I can sell this fish so I can buy other food to eat, versus like looking long-term at the conservation. So there's opposing views when we did the interviews in terms of like people always felt like conservation was important, but they sometimes felt like they could not align with the conservation efforts because they needed to prioritize their own household. So.
Shauna, one critical concept I'm taking away from here, and I'll reflect on it myself, is your insistence on interventions and dietary guidelines in the context of lived experience.
Yeah.
I think this is absolutely critical because some of the guidelines and interventions that we have nothing to do with people's real experience. And we can do a reality check to say, well, this is not for everybody. Sometimes I view those guidelines at times a little bit elitist.
Yeah.
But you do not. You really go for lived experience.
Yeah.
It's more about that.
I think that's so important because, you know, if you think about some of like the food systems intervention, so one is taxation policy, right? Which I am definitely pro-tax of sugary drinks. But if you're just like, okay, now just go to Kenya or go to Cambodia and tax the sugary drinks. Well, as I mentioned, a lot of the vendors are in the informal sector, so you're not taxing them anyway. And so that's not going to be an effective policy. There's probably other ways that you should be intervening within the food system that's going to have more impact. So I think it's critical. Like, I think that we can come up with some, like, repository of potential ways to intervene, and then we need to have some sort of decision trees around which contexts these tend to work best in.
I think it's very fascinating research that's being done in London and elsewhere and by you on the emerging or changing retail systems in low and middle income countries because we're going from informal food systems to more formal food systems with supermarkets and different style of paying. How very interesting. So this is my reflection for today. Thank you again. That was absolutely incredible.
Thank you. Thanks, everyone.